Thanks.
Okay, well, good afternoon, everyone, and welcome to our webinar today, Best Practices for Integrating Aquifer into Physician Assistant Education. You can go next slide. So my name is Cindy Lord. I am the Program Director and Associate Professor at the Case Western Reserve University School of Medicine PA program in Cleveland, Ohio. And I'll be hosting and presenting today along with my colleagues. Next slide. So today, our goal for today is to really learn more about Aquifer and its courses and cases. And then depending on your interest and where you signed up, we have our breakout sessions for use of Aquifer cases in clinical education, didactic education, and then we have a breakout room if you want to learn how to build a custom course. And of course, we'll have time for Q&A and next steps and some nice resources and tools to add to your toolbox. So I'd like to introduce our session leaders today. So co-hosting with me is Sherilyn Smith. Dr. Smith is the Chief Academic Officer of Aquifer and a Professor of Pediatrics at the University of Washington School of Medicine. We have with us Ann Walsh, Associate Professor from PA program at Chapman in California, and she's the Associate Professor, and Assistant Professor Michelle Zawara from Jefferson College of Health Professions in Pennsylvania, and Jensen Lewis, who's our Director of Didactic Curriculum and Assistant Professor at Case Western Reserve, and Leah Romano, our Relationship Manager at Aquifer. So we're all excited to meet and greet and talk to you and share our pearls and our tools. So quick review of the agenda. We're going to talk about a little bit about Aquifer and its pedagogy and how it works. And then we'll go into those breakout sessions. And our goal today is to have you, it's kind of like a grab and go. Can you grab a tool and go home and implement it? And we've heard from a lot of you that you're using the trial period and you're like, these are great, but I'm not quite sure what I should do with them. So we're going to throw some ideas out there for you, from big picture, lots of stuff, create a whole course, to here's one thing you can actually do right now. And then we'll come back together after our breakouts and we'll do Q&A and tools and resources and next steps. So of course, a little bit of housekeeping before we begin. I'd like you to please disable your video. You're automatically muted in this main session. In the breakouts, we're going to ask you to mute yourself, your audio, unless you're talking. We do ask that you would put your questions in the chat box, and we do have a moderator in each of the breakout rooms who will help with those Q&A. And then you'll be moved into a breakout room automatically at the end of this session. If for some reason you may get prompted to say, join breakout room, click that. Or if for some reason you're not in the right room or you've changed your mind, I think there's directions somehow for you to leave that, get back to the main session and find your breakout. So I thought it'd be important just a little bit, you know, it's all about me. No, not really. But I thought you'd kind of find it a little interesting. Like, how did I choose this? How did I choose Aquifer? And why did I choose Aquifer? Well, Aquifer kind of found me when I moved to Cleveland and started with Case. Amy Wilson-Delfoss, who's our Associate Dean for Curriculum in the med school, said, you know, you really need to look at Aquifer. She's very involved with them. And she said, this is a really cool product. And when I first looked at it, I thought, oh, it's neat, nice cases, and just, you know, another nice educational tool to put in my toolbox. And of course, not soon after that, I went down that rabbit hole of thinking, this might be the solution for all of my curricular needs, from remediation to assessment. And what I quickly found out is I learned that Aquifer is not another Me Too educational product. It's a consortium. It's a consortium of med ed educators who are dedicated to the education of competent healthcare providers. So soon after using it, the next thing I knew, I was invited to the annual Wellspring meeting, Aquifer's meeting in Boston, to present the PA profession, present PA education, and our unique curricular model. And circle around now, in the fall, Aquifer asked me to help lead a PA educator task force that they've developed, and we'll talk about that in a little bit. So okay, she's really quick. Next slide. So why do I think Aquifer is important? Well, you know, it's not a product, it's a pedagogy. It's a mindset, it's a philosophical shift from teaching and testing to fostering independent student learning in a safe space environment. And, teaching factoids, medical factoids, it's quick, it's easy, we all know that, but develop those critical thinking skills, those clinical reasoning skills, that's not easy. And really that is the entree to lifelong learning. So we are prepping our students to be excellent practitioners, not excellent test takers. And especially now, when this whole COVID thing broke, we immediately as PAs, we band together, we had, PAA put on those great webinars, and we thought, how do we rethink clinical education? And if you're like me, I thought of clinical education always as knowledge to practice and clinical application of skills to practice, and they were paired. And what we've done is we've taken them apart. For most of us, we've now removed our knowledge to practice and front loaded that while our students are out on, some may be in, but most of them are not in clinical right now. And so we're front loading all that knowledge in the hopes that when they drop back in, they will drop back in at a higher level. They'll have those clinical reasoning and critical thinking skills and be able to jump in quickly. So one small nonprofit, one giant impact. In just the month of March alone, over 250,000 courses completed by over 23,000 students from over 476 health professions, including 153 APA programs who are currently using the Aquifer content for free as part of the COVID response. I think that's an impact. So I talked briefly a minute ago about being asked to be on this PA Educator Task Force, and I'd like to call out to my colleagues here who come from all over the country with all levels of educational experience and experience with Aquifer, and some with no experience with Aquifer. And we've come together to meet with Aquifer as a task force. Our goal is to produce a PA Educator Guide to help faculty fully implement and utilize Aquifer cases and courses throughout PA curriculum, didactic to clinical. We started our work back in the fall and assembled ourselves, and we've been working along. Took a little hiatus now because of COVID, but we're going to rejoin soon. And our goal is to have our educator guide out in the fall sometime. So look forward to that educator guide coming soon to you all. I would like to give a call out to PAEA and to Karen Hills. Thank PAEA for their support of the PA Educator Task Force, and Karen for serving as the liaison to the task force. So now it gives me great pleasure to introduce Dr. Sherilyn Smith. Sherilyn is the Chief Academic Officer of Aquifer and Professor of Pediatrics at the University of Washington School of Medicine. Sherilyn, take it away.
Hey, great. Thanks, Cindy. You gave such an introduction, and I'm just amazed at you. So thank you so much. I have been with Aquifer from its beginnings, really. The Aquifer started as part of a grant in a pediatric organization, Concept, which is all the clerkship directors. And so I was one of the original case writers and have been with this great organization since then. And as Cindy has said, that we really are a consortium of educators coming together to help Aquifer achieve its mission. And I'm really proud, and even prouder now, to be part of this nonprofit organization that's really helping so many people. So what I'm going to do now is I'm going to go through some of the case underpinnings, and Eileen's going to stop there, and then we go, and I think this is going to work. So I just wanted to, I'm always like a little worried every time I do that. Okay, so what I'm going to do is kind of walk you through a little bit of what the cases look like, so you can really see what the students are and seeing, and then point out some of the features that I think are really important. So this is, I'm in Aqueduct, which is the platform that we talk about, that we use, sorry, and this is what you see. And so just as a little bit of an overview, so again, I'm going to go through these nice colorful things here, but we've talked about this COVID response, so I'm going to go into there. So that's the collection of all 5 of our what we call signature courses. So 146 cases of pediatrics, internal medicine, family medicine, geriatrics, and radiology. And all of the content was created by educators with their national organizations, the clerkship national organizations. It's all peer reviewed. It's all referenced, and I'll say that our 70 members of our consortium volunteer their time to keep it up to date. And so we're continuously making sure that new learning is incorporated. In addition to those 146 cases, you also have access to what we call our free courses that were also created in collaboration with other organizations like the American College of Physicians or the Society for Improving Diagnosis in Medicine. And they're the health, culture and healthcare, diagnostic excellence, high value care, medical home, and an oral case presentation skill. And I know that Jensen's going to highlight the oral case presentation skills in his breakout session. And so all of these are additional content that you can use in designing your courses. And I think that right now it's an opportunity to say, well, how can I pull high value care in? How can I talk about culture and health in a way that is very creative? So I talked about a lot of different, there are a lot of cases. And so one way, and I'm just going to point this out because Leah is doing a session about this, but we have a searchable case library. I'm just going to click on it so you can see what's in there, I hope. But you can really look through by clinical focus, by systems, by final diagnosis to figure out what cases are actually best for you. So in going through some of the resources here, I just want to highlight a few things for you all, and then we'll go into a case. So we've created a new course on onboarding resources. So for you to go back and review. So we are going to be highlighting a lot of these things today, but this is a very quick way if you want to know more about reporting or how to get help or the case pedagogy, this is here for you to come back to. We've created, the consortium and has created a bunch of educator resources. So I would say that if you have to do only one thing to help you integrate these cases into your curriculum is go to this resource and look in the educator resource areas. And so these are available for all of our courses, and I'm just going to show, I'm a pediatrician, so I'm just going to show you pediatrics, so sorry about that. But all of the courses have these elements. So we've created a quick case guide that really lists the names of the cases, what the differential diagnosis is, and what the final diagnosis is to help you get your brain around it. The searchable case library allows you to create courses from that. And then each course has an official educator guide. So this is a little preview of what is going to come for a PA educator guide. But our teaching and learning educators have gone through and given an overview of, say, the pedagogy that I'm talking about, as well as included case synopses. So this is available for you, and it tells you where is the case located, what is the narrative of the case, what it's about, and what are all the learning objectives. So this is a great resource for you to go and say, this is what I really need to use in my course. In addition, so for pediatrics and some of our other courses, there are other learning tools. So in pediatrics and radiology, they're flipped classroom modules. So they have facilitators, guides, questions. So this is a modified team-based learning module. The case analysis tool is another tool that you can have students interact with and go through the cases. And then the questions for further analysis actually are great discussion questions that link, say, public health or basic science to the different cases. So these are all available for you to see in the educator resource guide. So again, those are available for all of our courses, and I just really wanted to make sure that you guys knew about those. In addition, there's student learning resources so the students can see these clinical practice guidelines, so in one place for them to look at, and then there's a great pediatric developmental milestones. So for those who need to teach some pediatrics, it's little clips about the developmental milestones in the Denver table. So it's pretty useful. So what I'd like to do now is to dive into the actual case and to show you what Cindy was talking about when we talk about sort of the safe learning space and the clinical reasoning. And I think about this as deliberate practice for patient care. The way that I frame all of these cases, all of the aquifer cases, is like they're like standardized patients. So they're virtual standardized patients. They were created so that there's a little bit of context given to the students, and then you work through the history, the physical, the lab tests, and there's built-in ability to do diagnostic reasoning. So, to give you an example, this is the way that the cases look like to the students. They click on the little box, it opens up, and you have a little case, and one of the nice things is that it models communication, and there's interactivity that you can open it up so they have the question and there's the little answer to the question they have. So I think that there's real nice modeling about how you think about and then how you ask questions. If there's additional content that we think is important for students to know, but they may not need it to be able to navigate the patient encounter, these are included in deep dives. And so, for instance, this goes through the different types of palpitations because this is a case with palpitations. So it's just a little place for the students to go and learn a little bit more. Each one of these cases takes somewhere between 30 and 45 minutes to complete. So keep that in mind as you're thinking about how to use them in your cases. I mean,
Charlene, this is Eileen. I apologize, about a 2.5-minute warning.
Okay, thanks. And then and here is the references. And so as you can see, this goes through all of the elements of the case. There's a really great thing called a summary statement. So students are asked to write what they think are the most important things of the case. They can go through and as they're going through, write down the diagnoses that are coming through, the findings that they think are important to the cases, so that helps them create the summary statement. Also, they have, the ability to answer questions. So there are multiple choice questions having to do with the differential diagnosis or learning questions. You can't see the answers to these. These are learning questions, but then they get the answer comments there right underneath. As the students go through, they continue to work through the case, and as they get to the end of the case, they get a case summary. So just so you know what kind of content they get as it's thinking. So here is the case summary. So this is all the content that they have learned. It's given to them in a way that they can study. I think that bringing this to your case discussions and asking them what kinds of questions they have, what was hard, is another way to engage them. And all of the cases have self-assessment questions at the end, right? So in thinking about the last thing that I'd like to show you all is, because you all are educators, is you want to know how your students are doing. So you go to the course report and you can see this is what it looks like, how your students are doing, right? And the red means they haven't started. You can see that people are sort of intermediate, and the green checks are the ones that they've completed. If you have a green check with a circle around it, it means they've reset it. And so if you want to know how a particular student is doing, you click on their name, and then you can see this type of report. So remember, oops, where did it go? So remember I said that the summary statements are there for the students to use. In your reports, you actually get to see the students' summary statements. So if you all are thinking about assessment and how can you figure out whether, how students are learning, you can actually see this as a great thing for them to bring to class with them, practice their oral case presentations, and then you can see here is the expert. So you can see how they're doing compared to what we think that they should be doing. So that was just a really quick overview of all the things that you can get in Aquifer. So what we're going to be doing now is transitioning to breaks. So everybody's going to go to their breakout rooms, and we'll come back together as a group at 3:50. So see you all soon, and thank you for listening.
Beachy Day.
So Eileen, you're going to play host to our Q&A session? Eileen must be on mute, but I think she is going to let us know about questions that you have for myself, Anne, Jensen, Michelle, Leah.
Sorry, and if you go ahead and pop them into to chat, I can read them out to Cindy. But we did get a lot of questions from your last session, Cindy, about your mini rotations, about how long those last. How do you set up a mini rotation?
Okay, so that's Michelle, that's you, right?
That was me, Anne.
Go ahead.
Yes. So the mini rotations are 1 week, 6 days worth of work, and then the last day they submit their self-assessment, exam score, and reflection.
Terrific. We've got some questions about whether the session's being recorded and whether you'd be able to pop in and see the other sessions. And yes, you will. Cindy will be posting in a moment where you'll be able to see that. But we recorded all the mini sessions, so we should be able to share that with you. For questions on, we're getting some technical questions about how do you add students, how do students reset a case. Really encourage you to go to the help on that. We've got some great resources online on aquifer.org that can go into some of the technical details on that and help you with that.
Eileen, there are videos too, right?
There are terrific videos. Yep. And we're also getting some questions about purchase, continue your subscriptions, and if there be any help if you need to purchase a subscription for the COVID package that you've got right now. We're working really hard on that right now. We're a not-for-profit organization and really dedicated to figuring out how we can serve our learners and educational institutions in this time of need. So we are working on what we can do in terms of developing a grant program to help defer some of the cost. So some information will be coming out in that within the coming weeks. There would still be a cost to your institution, but to help programs who we know are going through incredible hard times right now. So thank you.
Eileen, I saw somebody popped in about ARC-PA feedback. I will say that we haven't had feedback yet on our COVID piece, but we've been using Aquifer for the last, well, since we started the program in 2016, and I know Anne's used it for years. It's been in our self-study for the last 5 years. It's and they have never had issue with it. So we're just kind of reflavoring how we're using it. But I haven't had feedback yet, and I don't know about Anne or Michelle.
Yeah, the feedback that we got, actually, I began using it in this way for LCME, for medical school, missing logs, and they absolutely loved it. So I transitioned it when I began in PA education, and the feedback has been fine. Just remember, as I put in the chat, learning outcomes and all of your requirements are program defined. And so as long as you can measure and demonstrate and articulate that the students are meeting the program learning outcomes, if this is the way that it works, it's fine. Now, of course, virtual encounters cannot substitute for an entire clinical rotation. We all know that statement came out. But what we're able to do is that we're going to shorten our rotations when our students are able to get back in clinic. We can shorten them by 1 week because we've demonstrated that they've worked full time for an entire week with virtual cases they've logged, everything maps to the outcomes. And we actually just submitted this to ARC-PA as a curriculum change and it was approved. So I can say that.
Thank you. I mean, I think it's important to note this is a wonderful tool, but it is not the end all be all. Again, when I first got introduced, I'm like, wow, this will be my best tool and it will fill all of my needs. You need to know what you're going to use it for. And again, it's that whole mind shift about, am I educating my students to take a test or to be good thinkers and to be great clinicians? And so I think you integrate it into your curriculum the way it best fits for you. And it's a piece of helping us achieve our program learning outcomes and meeting those standards. So I think you really have to keep that in mind. There's no one product does it all.
Mhm.
Could I also just make a quick comment? There's some questions about grading and how do we grade? And I just want to reiterate that really this is a learning platform, and it's that so-called safe space where students can discuss and learn and make mistakes. And the second you start putting a grade on it, the purpose is lost. You know, students can game numbers and game the system, and that's not the purpose. The purpose really is learning. So eventually when the exams come out, based on these cases, that's another way you can use it for assessment. But right now, really, the tool is a learning tool more than an assessment tool.
Right, and you can do, so you can grade on things. We grade on things like their notes, we grade on oral presentation, because those are skills that we're trying to practice. But the other pieces, we really are trying to leave a safe space. And we've just found with the rich discussion and reflection that the students, and we have part of our task force has a student arm. We've got 2 students that are serving on the task force, and their feedback was amazing on their interactions with Aquifer over the last 2 years. Both of them are clinical students, how they feel they think differently. So again, you have to reshift your mind that everything is not about a grade. A great test taker does not always make a great clinician.
I'm gonna, Cindy, I think we'll close up the questions and move you to the last
So we promised you some more resources. So we've got aquifer.org. We've got a new, the Teaching Perspectives and Pearls blog just releasing now. We've got our user story videos, which are really great and moving. A lot of videos and tutorials on the how-tos, really easy. And then in Aqueduct, those educator guides, I would urge you to download those. They are great. And the resources, and then the student learning resources. There are one-on-one peer consults. I know everybody, there's so many programs now using Aquifer, but you can sign up at aquifer.org for those one-on-one peer consults. And all of us are around, you know who we are now. So in wrapping up, there is a survey to come in a mailbox, in an email coming to you soon. So please complete it. We'd like that feedback. We definitely want to give a shout out to PAEA. Thank you very much for helping us get the word out and to help us offer the webinar. And again, for Karen being the liaison, working with us on the task force for that PA educator guide soon to come. And then yes, Jen H, the webinar is recorded and it's going to be available at aquifer.org, and PAEA has offered to put it up on PAEA so that all educators can have access. So stay with us. We're on Twitter, and thank you everybody. I really want to thank our presenters. They were awesome. Another great resource, PAs, we rock as educators, best profession. So try to use your tools, and thank you everybody, and stay safe, and hopefully we're through COVID soon. Signing out.
And thank you so much, Cindy and Ann and Michelle and Jensen and Sherilyn and Leah. Fabulous job. Wonderful comments in the chat. And just want to say thank you from all of us here at Aquifer. Wonderful, wonderful job. We appreciate it.
Thank you. Wonderful. Thank you.
Bye.
Bye.